The COVID-19 coronavirus is spreading.
And therefore, I'm announcing today a soft closure of all of Utah's public schools.
And the state of Utah is taking action.
But even with these measures, we expect to have more cases here.
Panic threatening to overtax our hospitals.
Unfortunately, this time we can't test everybody.
ABC4 News is putting the emphasis on preparation versus panic.
Panic is not the solution in any situation, right? Being prepared is always in order, and that's what we're asking people to do.
We are sorting out the facts and helping you get ready in the midst of an outbreak.
Now, from ABC4 News, coronavirus preparation versus panic.
Thank you so much for joining us tonight for this special presentation, Coronavirus Preparation versus Panic. I'm Glenn Mills. We begin with where Utah stands on confirmed cases of COVID-19. 29 Utah residents have tested positive for the virus, as well as 10 visitors. We've seen the highest number of cases in Salt Lake County, where that total stands at 18. In the United States, there have been as many as 3,900 positive cases of COVID-19. Now, all 50 states, along with the District of Columbia and Puerto Rico, Guam, and U.S. Virgin Islands, all have cases. As the virus spreads, state and federal health agencies say they are working around the clock to administer more tests and treat the growing number of patients.
As of Monday, we will have more than 2,000 labs coming online with the high-speed testing, and we are connecting states to those testing methods.
Drive-through testing sites are popping up across the country, including right here in Utah. Governor Gary Herbert says we have 3 areas of drive-up testing currently available, and 2 more are expected to open on Tuesday. As of today, the CDC says it has processed more than 4,000 test kits since the outbreak began, and other U.S. laboratories have tested more than 20,000. The state of Utah has issued a number of recommendations for everyone across the state, mostly involving forms of social distancing.
Again, in talking about social distancing, we know that that's awkward. It's not what we're accustomed to, but it's something that we need to, in fact, implement in our lives today.
Officials are encouraging everyone to avoid large gatherings. If you're at risk, avoid going out altogether if possible. Work from home if you can. The state also encourages restricting access for visitors, especially at elderly care centers. If you believe you're sick and it's not an emergency, stay home and call your medical provider. The governor, along with other state, local, and business leaders, announcing more measures today to help stop coronavirus in its tracks and ensure the health of our economy in the meantime.
We are here for you. We have been devastated as a city to hear about our business interruption that's happening in our community and the very personal impacts on our residents.
Salt Lake City Mayor Erin Mendenhall announcing the creation of a small business recovery task force. In a survey of local businesses, she says 76% of those who responded saw a decrease in revenue since the outbreak. She also called on landlords to be compassionate with their tenants as the city works to expand rental assistance. The governor announcing the creation of a new economic task force as well, which will have its first meeting on Tuesday. Tonight, we are also taking a closer look at how this pandemic impacts children. Let's go now to ABC4's senior health correspondent, Saray Chen.
We've been talking a lot about the risks surrounding the older population when it comes to COVID-19. We want to now turn our attention to the children, nursing moms, and moms-to-be. We have Dr. Pavia here with U of U Health and Intermountain Primary Children's Hospital. Thanks so much for being here.
Thank you for having me.
Let's talk about the children. How much are they at risk?
So in most epidemics, we of course worry about our children the most. The good news about COVID-19 is that children do get infected with the virus, but they very rarely get terribly sick. There have been almost no deaths worldwide. Only a handful of kids have ended up in ICUs. It can happen, but it's very rare.
So the concern is when those children may come in contact with grandma and grandpa.
Exactly. You know, you might think, why shouldn't I let my children get infected? And the reason is that children can pass the virus along. They can pass it along to adults who can aid in the spread and sort of ruin our containment efforts. But most importantly, they can visit grandma or grandpa or somebody who's immunocompromised, where instead of being an annoyance, this could be a deadly illness.
And so maybe we can still have a play date with 1 or 2 children, making sure that they don't go back to see grandma and grandpa for a while.
Well, it's sad to say, but I think separating our younger children from their grandparents and from the elderly is one of the social distancing moves that we should try and do as much as we can, because protecting kids from ever getting infected is something we should work for, but it's going to be really difficult.
What do we know about nursing moms and how maybe the virus is contracted and how that might affect the baby or the fetus?
So we have to preface everything we say by the fact that we're learning as we go, but we're now almost 3.5 months into the epidemic, so we're getting a little more certain. It does not look like the virus can be passed in breast milk. Neither this nor its close relatives have ever been found in breast milk. So as a pediatrician, you have to encourage breastfeeding whenever possible. Pregnant women do seem to be able to pass the virus to their infants from close face-to-face contact, from droplets. And so if a mother is sick with COVID-19, we have recommendations on how to prevent transmission. The other thing everyone worries about is, can you pass it on in utero? And to date, there's no evidence of that, although we are still learning and still watching.
The interesting thing is when children get it, it seems to be that the symptoms are milder than, say, someone older who might be contracted.
That's absolutely true, and this is true for some other childhood diseases. You know, chickenpox is milder in kids than in adults, but it's really pretty striking here that children really don't seem to get the pneumonia or the severe lung disease. They may have changes on their chest x-rays when you look for it, but they're not becoming short of breath. As a rule, they're not getting into respiratory difficulty. Flu right now is causing far more serious illness in children worldwide than COVID-19 is.
A good reminder there. Let's run through quickly what are the symptoms when it comes to children and COVID-19.
The symptoms are pretty similar to adults. The predominant symptoms are fever, muscle aches, sometimes headache, occasionally a scratchy throat. Children do tend to get runny noses with this, but most kids who just have a runny nose, it's going to be a cold, it's going to be another virus. Adults rarely get a runny nose, so it's one of the things that gives us a little bit of ability to tell the difference between the two viruses.
Dr. Pavia, such great information and knowledge that people at home need to know from the U of U Health and Intermountain Primary Children's Hospital. Thank you so much.
Thank you.
Still ahead, more of the impact the COVID-19 pandemic has had on our children.
It's a Monday morning. There are no school buses on the streets.
Schools are dismissed to help stop the spread of the virus. What resources are still available for parents and students? Next.